Hi, my name is Elisa Minkin. I'm a general pediatrician and I'm the co-chair of the Jewish Orthodox Women's Medical Association Preventative Health Committee. And I'm here today with Dr. Hindi Mermelstein. Dr. Mermelstein is a board-certified psychiatrist from the American Board of Psychiatry and Neurology with many years of clinical experience. She holds additional boards in both geriatric psychiatry and psychosomatic medicine and has been recognized as a fellow of the American Psychiatric Association and the Academy of Psychosomatic Medicine. Her clinical practice is focused on complex patients, many of whom suffer from serious medical illnesses and struggle with significant symptoms such as neurological and cognitive dysfunction that affects the individual, their family, and often the community in which they live. Also, Dr. Mermelstein has extensive experience in administrative and legal issues for physicians and other healthcare providers, both outpatient and hospital settings, with experience consulting to and collaborating with non-medical agency families, care managers, and caregivers. She has published, presented to medical professional and lay groups as she continues to teach, train, and supervise medical students, resident physicians, and non-physical groups. Wow, that's really impressive. Thank you so much for joining me today. Can I call you
Thank
Hindi?
you for, yes, please. Thank you for
I'm Elisa.
inviting me.
So today is exciting because today, Wednesday, May 27th, is the day that Long Island starts phase 1 of reopening. So we're really starting a new phase. I mean, I'm from Long Island and you're also.
And so am I.
Right. So that's our area, but hopefully soon the other areas in New York that have been unfortunately very, very hard hit by COVID will start doing more opening up. And that's a whole new phase for us and a whole new set of decisions. So I wanted to talk with you about making these risk-benefit decisions because that's really what they are.
It is, thank you, like I said, thank you for inviting me. It is a challenge. It's a challenge for all of us because in some ways we make risk-benefit decisions all the time.
Mhm.
If you think about it, right, we go to school, we plan children, we plan all these things because we believe that God willing, when we start college or medical school or whatever it is, that we will have the ability to finish. We sort of live in a world where we practice what I call healthy denial. We go get in our cars, and even if we have an accident, thank God, the overwhelming number of accidents are fender benders. You know, they're small property damage. But we get in our car, and after we've had a small accident, we get back into our car, and maybe we belt our seatbelt a little bit tighter. And maybe we check our mirrors a little bit more. But then we go ahead and drive, because if we'd spent the whole time thinking about all the things that could happen to us, we'd be so distracted that we would indeed be at risk for a very serious accident. So the truth is that we take risks all the time. We incorporate risk all the time. And we find some way of living and managing as if the risk, once we've paid some attention, is not actively there. And then we do it actually even for fun, right? People play sports. People go skiing. People go biking. When you go biking, you have to wear a helmet. And if it was me, I'd have to wear knee pads and ankle pads. And I'd have to be, because I have no sense of balance. Trust me, you wouldn't want to be next to me on a bike ever. But whatever it is, we pay attention to what risk is. We attend to it, and then we go on with our lives. So in some ways, we've all been practicing risk or reading risk tea leaves in some way or another, and because life demands it, life requires it. So what's going on now? Well, one of the reasons that we're able to assume risk and incorporate risk generally in our lives is because all things in life are always possible, but not all things are probable. Meaning, going back to the example of the car accident, it is everything. When you get into your car in the morning, everything that could happen is possible. But we know, thank God, a million times, thank God, accidents or serious accidents are not probable. Because if you think about the number of times you get into your car and go drive somewhere and come home and everything is okay, it far, far, far outweighs the number of times that something terrible happens. But what happens when the possible becomes the probable? that's what, when that happens, people are traumatized. We saw that in the Shoah. You know, you talk to survivors. They talk about how their life was fine, and the impossible happened. The things they thought could never happen happened. In some ways, actually, COVID, I'm not comparing it to the Shoah, to the Holocaust, but in some ways, it too shares the fact that the impossible became the probable. COVID came upon us like a tidal wave, like a tsunami, and it hit us. It hit us, it washed over us, and left death, destruction, and distress in its wake. In some communities, such as, unfortunately, the religious community, and especially in the New York area, it hit exceptionally hard. As the president of one of the shuls reminded us, that there were 100,000, we are now at 100,000 people across the United States that have died of COVID, and only 53,000 people were killed in the Vietnam War.
Wow.
Right. So now, having said that, 100,000 people out of, given how large our country is, believe it or not, is still a small number. But it is true, the possible, which we don't live in the possible, we live in the probable, became the reality. So we're left with COVID has left us actually with two parallel senses of vulnerability. One is the fear of contagion, which is where we lived, and one is the contagion of fear, which is where we lived and where we are at risk of living now. So what to do, right? We had the stay-at-home orders, the stay in place, the shelter in place, whatever was called in our community, each community, really was critical. It was critical because we had to flatten the curve. We had to make sure that our healthcare system, which was threatened to be overwhelmed, was able to manage. We had to shelter in place because we had to learn more about the virus. We had to learn more about the illness and how to manage it. So although we still don't have a cure, we have a much, much better sense of how to manage it. We have a much, much better sense of what to do, and an ability to understand what some of the illness can look like. And it was invaluable to help our healthcare system be prepared. What should they be prepared for? They should be prepared they should be prepared both in the future in general and maybe a little bit specifics, because having said that we have to reopen, and I'll talk about that in a minute, it doesn't mean that there is no risk, right? Mm-hmm. The reason that we're able to reopen in Long Island today and upstate New York last week or 2 weeks ago, and Connecticut as well, and Jersey as well, you can tell that we're Northeastern centric here. Okay, I apologize a little. It's because we've met the benchmarks that have been set that we can reopen. But the benchmarks, unfortunately, don't mean that there are not still people that are affected by the illness. The benchmarks, unfortunately, do not mean that the risk has gone away. Right. It's just that the risk has been decreased. And maybe that's what makes it most challenging for us, right? Because if it was absolute, if it was black and white, if it was really true the way that some people have begun to conceive of it, that if you go outside of your house, I have friends who've not been outside of their house for 2 months, and trying to tell them that it's not, God forbid, radiation, and that right. It's safe to literally go outside, terrifies them. But if it was, God forbid, so absolute that it was inside or out, it would be terrifying, but in some ways it would be easier, right? because then it would be black and white. And because when we're really so terrified and scared, and when we've been traumatized the way that we have from COVID in some which way, in some ways, we want to know what to do. We want to know what we need to do. We want to know what we need to do to protect ourselves and our families and our communities. And we're learning and we're trying and we are negotiating, but we're negotiating using the information that we have, which is not enough, which is not absolute. So when we talk about reading risk clearly, what exactly are we talking about? Well, we're talking about two things. We're talking about the fact that we need to actually reopen. Why? Because the COVID pandemic that threatened to overrun us and ran over us at the same time, it was like having an acute illness, right? When someone is acutely sick in your house, or you're God forbid, acutely sick, the world stops. You stop and the world stops. But the assumption is it's going to be short. It's going to be time limited. So when you begin to get better, you will re-enter the world. But when the illness is chronic, when it goes from being acute to being chronic, the job that we have is slightly different. The job we have is not to go on pause, as we have done, but to incorporate the condition, or in this time, some sort of the risk assessment, into our lives so our lives can go on anyway.
Right, the new normal.
To be normal.
The new normal.
Right.
The new normal.
A new normal, right. Having a chronic illness is when they talk about a new normal, it's a new normal. It's not the same as it was before you got sick. God willing, at some point it'll, but it's an attempt at coming closer to that, especially over time. And it takes time. It takes time to begin to make your new normal close to the old normal, or new normal that works for life. It's very important. The other thing is that we have to reopen, and so that's our responsibility. That's our job. We also have to reopen because the cost of not reopening is beginning to grow, and I don't mean only financial. There's a lot of talk out there about which comparing lives versus money, and I'm not talking about that. There's truth to that. The economy, it's true. And the economy is just not about money. It's about self-esteem. It's about structure. It's about jobs. It's about livelihood. It's about all those things that are so important to us. But it's more than that, right? There was an article about the number of children. Dr. Minkin is a pediatrician. The number of children that have not gotten their vaccines. The number of women that have not gotten their their mammograms or their breast biopsies. The number of people that still can't get an echo for their heart unless they go into the hospital. So, and the number of people, and so just the number, it's about the structure. It's about children need a structure in their life. The children that are traumatized and are afraid of strangers. Now, a little stranger danger is always good, but they have become convinced that if they're outside and see someone, that somehow or other the risk is huge. The risk is tremendous. And so we need to reopen because the non-COVID world, and yes, there is a non-COVID world in spite of the fact that it didn't feel that way for the last 2 months. The non-COVID world needs attention too. It's really where we live. Thank God it's where most of us live. It's hard, sometimes it's hard for us to conceive that 80 to 90% of people that were affected by the virus tolerated it okay. 80% of it tolerated it okay. 10% had it was the worst experience they think they've had. Thank God that may that be the worst experience, but they were still okay. And then a small percentage were very sick, and a smaller percentage of that were deathly ill, and a small percentage even of that died. But the longer we stay in, the harder it is for us to recognize that that's what we're really talking about, because the more COVID and the more the COVID disaster and terror and destruction is the only thing that we see. Because we don't see our normal life. We don't re-enter our normal life. We can't remember, or it's hard to remember what the new normal, we were talking about new normal before. The new normal includes the word normal. And it's important to remember, and it's important to be reintroduced and to allow yourself to recognize that the new normal is based on normal. Changed, altered, maybe for a short term, maybe for a long term, but still it's based on normal. So when
I don't mean to interrupt you. I think that it's important to say that our risk-benefit decisions are going to be vastly different as we come down the other side of the curve, that it's not the same risk to go out and re-enter. That's why we're able to. Right. And so our decisions have to incorporate that decreased but still existing risk.
Right. Of course, you're right. I mean, that's one. When I talk about reading risk tea leaves, we're talking about resetting back to the idea of probability versus possibility. That now that the curve is coming down, and now that we have better information, if not better information, that's exactly that you're exactly right. That's exactly the point. It's safe to have this conversation, and it's safe to begin to reopen, because we're back to being able to assess what the probability is, what the risk is.
But I think we're still making this with way too little information and with shifting advice. I mean, the CDC has said you can get it from surfaces. No, you can't. Yes, you can. So it makes it difficult that we don't have enough information. We are definitely still dealing with uncertainty, but with a decreased risk, a decreased probability of actually getting COVID.
Right. Right. You're right. So we're now able to go back to probability versus possibility, because when you go outside, it's not likely that you're going to be struck by COVID lightning.
Right.
And even if you do, that God forbid you're going to die of that. You know, those two things. I'm being very black and white, but you know, and that you're right. The probability has also decreased. Going back to even the everyday car example, the probability, not only are things all possible, but the probability of being seriously hurt have begun to decrease. But yes, if we had more information, if it would allow us to use our intellect in a different way. It would allow us to think that we could understand the numbers and make a judgment. So
this is a limited analogy, but say a very bad storm. What do you do in a very bad storm? You shelter in place. When you come out, at first the road conditions are not going to be ideal, but you can find out what they are.
Well, you can and you can't. When you go out, if you go out after a very bad storm, you're not sure. When you go into your car, you're not sure how. You have to assess how slippery it is, how slippery it's not. You don't know if there are going to be trees in the way. But once the acute or hyperacute sense of danger decreases, you can get some information, incomplete, and you can use your judgment, some, to figure out what you can and cannot manage. So, and it's different for every person. So, for example, someone who has many experiences driving, years of driving, and has good snow tires, may be able to manage a road condition that is more risky than someone who's a young driver, or someone that has bald tires, right? Or someone that has never driven in snow.
Right.
And I think it applies here too, right? Because not only do we not have enough information, and not only does the information still continue to change, you can get it from surfaces, you can't get it from surfaces, what the antibody tests mean and what they don't mean, you know, these testing, all those things that we are still trying to learn, and we get different, which makes our decisions harder, because we end up having to rely on ourselves more. But the reality is that someone who is at high risk of having a of having a complicated course if they have COVID is at a different level of risk and has to assess that differently. So,
Absolutely.
right? So there's a question
Mhm.
about how to open up some of the schools, right? And
Mhm.
so they were talking about who should have priority in the minion. This is not a political question,
Mhm.
but there's a question about whether or not, if you're over 65, for example, are people comfortable having, going to Minion? Should they be comfortable for going to Minion? Because we know that being older is a risk factor for having a complicated course,
Mhm.
right? If you have a
Mhm.
all those things. And so each person has to assess that risk, because not only is it going to change over time for the better, continuing, we hope, but in the new normal, what your condition is affects how you develop and how you assess and how you move through the new normal.
Mhm.
So our job is to reset back to probability versus possibility, and probability that's also declining. The risk is also declining in reality. And I would think that if you need reassurance, that look at the fact that we're able to open because we've met all those benchmarks.
Benchmarks, right.
That is a message from the government who's keeping track. That is a sort of a pragmatic, sort of confirmable message that says that things have improved.
Right, but the phases mean that more things are going to be allowed over time. And I like the idea of, if you were going to get back on the road after a storm, you wouldn't go as fast.
No, you wouldn't go as fast, and you would be more cautious,
Mhm.
and you would not, and if you were not very experienced, you'd be even more cautious. And right, you wouldn't go as fast, you wouldn't go as far. You would check the road conditions, maybe where you're going, right?
You may not go if you didn't need to.
And you certainly would not go, right, and you wouldn't necessarily go if you needed to. We also have to begin to rely on what we know versus what we fear.
Mhm.
Because the other reality that's happening, when I'm frustrated, I sort of said that in some ways I'm afraid that we're developing communal agoraphobia.
Right.
That people are, the longer they're not going out, the more they're afraid to go out, and their fear. It's reasonable to be concerned and to sort of assess what's going on. It's worrisome and problematic when the fear of what could be is beginning to be separated. It's going in the wrong direction from what is improved.
Right. And I think you're not really referring to people with overt diagnosable mental health disorders,
No,
because I'm really wondering whether it's throwing people over the edge, over the spectrum of, having an issue with something to having a full-blown disorder, say agoraphobia, fear of being in open
yes.
spaces, or OCD, obsessive compulsive disorder, with all of this contamination. Everybody is cleaning their
Right. Well,
groceries.
look, I mean, it's what I said. It's what I've said in other settings.
Mhm.
People who are socially anxious
Mhm.
originally thought this was great,
Mhm.
right? They
Right.
finally got their wish,
The introvert
except
meme, yeah.
the introvert, except that now they also lost all their social structure
Right.
and all the support. So many of them have become depressed. But
Mhm.
yes, going back to this story of a child who passed a neighbor the kid was riding a bike, and the neighbor was across the street in their driveway, and the kid had a panic attack, thinking that seeing another human being was unsafe.
Mhm.
So yes, if you take that story and you apply it to how many people are literally afraid to go out now, and it's worrisome, because people that did not have, I'm not talking about people that were agoraphobic before. I'm not
Mhm.
talking about people, some of them actually are happy because they're never alone now. But I'm not talking about people
It's
who,
normal now.
it's normal now. Everybody is agoraphobic,
There we go. It's normal to
There we
be
go.
home.
I'm not talking about people who are obsessional.
Right.
But I'm talking about I'm talking about the difficulty in tolerating, I use the word risk, but it's also the anxiety or the uncertainty,
Right.
rather, that we have to deal with. But we've been dealing with this all our lives, which is why I started with the normal things,
Right.
you know,
Absolutely.
like with, and in some way, and although this is unusual, and this is this experience was something that we've never had in life, and God
Right.
willing, we will never have again.
Amen. Huh.
Some of the principles
Mhm.
apply across the board,
Mhm.
you know, and that we really have to mitigate risk. We have to be reasonable. Going back to the analogy of the car, you know, you you stay at home when it's really unsafe, and then you go outside when you need to. You figure out what safe driving conditions are, you apply them, and you change course if you need to midstream, right? That
Mhm.
too. If you, and I'm using a minion not as a statement, but just as a reality. If
Mhm.
you know, if you go someplace and you find that everyone's crowded on top of each other, you may not decide to stay.
Right. Uncomfortable leave. It's not
Yeah, you know, because
your risk tolerance.
social distancing, and you know, good hygiene and masks when it's appropriate are correct. They're a way to mitigate risk. They're a
Right.
way to be appropriate. They're a way to put on your bicycle helmet. They're a way to check your seatbelt. They're a way to take care of what really does make better and really does decrease the probability. And the last job is to, you know, reaffirm life and hope and live there and future as opposed to fear.
Absolutely.
So I'm really happy to answer any questions or discuss this, but you know, I look forward to, God willing, all of us taking this challenge and being able to do that and restore a new normal with God's help that will eventually, over time, approximate and maybe even return us to what life had been before
No,
COVID-19 hit.
I really hope so. I really hope so too. And I thank you so much. And I just want to end with an anonymous piece. I don't know who wrote this that I found. I'm just going to read it because I think that it's a nice way to end. It says, as we are trying to figure out how to ease back into a new normal, please keep in mind no one has ever done this before. So please remember, some people don't agree with businesses opening. That's okay. Be kind. Some people are still planning to stay home. That's okay. Be kind. Some are still scared of getting the virus and a second wave happening. That's okay. Be kind. Some are sighing with relief to go back to work knowing they may not lose their business or their homes. That's okay. Be kind. Some are thankful that they can finally have that surgery they have put off. That's okay. Be kind. Some will be able to attend interviews after weeks without a job. That's okay. Be kind. Some will wear masks for weeks or maybe even months. That's okay. Be kind. Some people will rush out to get their hair or nails done. That's okay. Be kind. The point is, everyone has different viewpoints, feelings, and that's okay. Be kind. We each have a different story. If you need to stay home, but be kind. If you need to go out, just respect others when in public and be kind. Don't judge fellow humans for what they do or don't do. You don't know their story. We're all in a different mental state than we were a few months ago. So remember, be kind. I thank you so much for doing this with me.
It was a pleasure. Thank you very much.
Yes, be well.
Okay. Bye-bye.